Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And as you know, February is Heart Month, and this is actually a very special time because it's leap year. In last 2 weeks ago, in part one, we discussed kind of we had held a discussion on current concepts in cardiology. And what I wanted to emphasize is that my aim as a cardiologist is to assess your risk, your cardiac risk, and to treat it accordingly. So, I mean, I could care less about your numbers. Well, to a certain extent. For example, a lot of doctors will just treat your numbers, your cholesterol numbers. Oh, you need to be on a statin. And my feeling about this is that if you're low risk, if you're truly low risk, I don't care how high your cholesterol is, unless it's astronomically high. I wouldn't cheat. I wouldn't treat it. But that's not how traditional medicine goes. That's one thing. We also discussed lesser known risk factors for heart disease that are underappreciated and undervalued by your traditional cardiologist. It's really important because we really want to prevent heart disease. And as you know, there's still over 700,000 heart attacks every year in this country, and over 600,000 people die of heart disease annually. So the numbers are still pretty high, which means we need to look outside the box and to look at some of these lesser known risk factors that can be treated and can be modified with with testing or with lifestyle. And we also discussed various cutting edge tests that I think are really important, because these tests help to figure out your actual risk, to determine your risk. So information is really good here. So my whole thing has always been, my whole adage has been test, don't guess, because knowledge is powerful and we can do a lot with it. Well, that was part one, and that was 2 weeks ago. Part two is tonight, and we're going to talk about lifestyle. This is another facet of health that goes ignored oftentimes and certainly underappreciated by your traditional medicine and even in traditional cardiology. And there's 5 components we want to briefly talk about tonight. Number one, nutrition, diet. You are what you eat. Number two, supplementation. Do you need to supplement? And if so, why? And if so, with what? Number three, exercise. You got to move. These are actual chapters in my book. So all these are discussed in my book. Number four is stress management. And that chapter is entitled, You Gotta Breathe. And then number 5 is sleep hygiene. So those are the 5 things we're going to discuss tonight. And I want to just bring your awareness to all this. So let's talk about, I'm often asked this question, what is the ideal cardiac diet? What is the best diet for heart patients to prevent heart disease? And my answer is going to surprise you, because there is no such thing. There is no such thing as an ideal cardiac diet. Why? Because there are too many variables. We are all different. And I'm totally against putting people and one size fits all. It just doesn't work. So, and some of these variables are genetics, individual goals. Some people are into performance, some people are into weight loss, some people are into enhanced energy, and your diet will reflect that. Your age, food allergies and food sensitivities, and your lifestyle. Do you travel a lot? What is your career like? Are you exercising? Your medical history is important. Do you have heart disease or hypertension or cancer or diabetes or obesity? All these things come into play when it comes to discussing what diet is best for you. Your lipid profile is also important. Your cholesterol, we know about that. Dr. discussed that last week. And your metabolic profile. And we already know from my previous talks that 5% of the adult population in this country is metabolically healthy, which means 95% are unhealthy, which is a travesty, really. And also gut function. I think we all know that the gut is the second brain, and we have to really pay attention to what we eat and how it affects our gut. So there's just too many variables to come out with one healthy, ideal cardiac diet. Now, most people expect me, when I talk about diet, I'm going to talk about low fat, low cholesterol, and I don't talk about that because I really don't care. And I think that's really last century medicine. Okay, so I'm going to go over a couple myths. I discussed 10 nutritional myths in my book. We're just going to go over about 2 or 3 here right now tonight. And one of the most common ones is eggs are bad for you. Okay, this has been around since the 50s and 60s. And actually, there's an organization called the Dietary Guidelines Advisory Committee from the government withdrew its long-standing warning about cholesterol from eggs. This was in 2015. So we're talking 9 years in which this took place, this statement. So they even withdrew it. Yet the American Heart Association is still recommending that only 8% of your total calories come from saturated fat. I don't know. They're still saying this, but fortunately, this organization, which is a segment of the government, withdrew. Combated 40 years of governmental warnings about how bad cholesterol is and eggs because they're so full in cholesterol. Number 2 myth. This is my favorite. Saturated fat is bad for you. This was thinking by Ansel Keys in the 60s and 70s, and it just somehow there was this myth that came about that saturated fat does increase LDL cholesterol, and because there's an increase in LDL cholesterol, this lodges into the artery walls and starts forming plaque, although this has never really been proven. And we know now that it's not just LDL cholesterol. LDL cholesterol is not some villain, okay? I'm tired of it being vilified, actually, because it's oxidized LDL, transformed LDL. That is the real problem, not just LDL itself. So again, you can see an increase in LDL cholesterol based on the diet higher in saturated fat. It doesn't necessarily equate to heart disease. So many guidelines are still based on this premise, but it's never been proven, folks. It's never been proven. In fact, recent studies have really helped to debunk this old myth from 40, 50 years. There's no place for it anymore. And there's actually a few good things about LDL cholesterol. First of all, it's saturated fat rather, which increases LDL cholesterol. That is, it can raise HDL, the so-called healthy cholesterol. It can also increase the size of the LDL particles. And if you know anything about me, I'm always telling people that LDL bigger is better. So if saturated fat can do that, I think it's a good thing. So we need to, I look forward to the day, hopefully I'm still be around, when they say, saturated fat isn't such a bad thing after all. But this has been really, since when I was a student, this is the thing, this is back in the 70s, late 70s. Number 3, grains are good for you. Really? Name them. Grains are lousy for you, as far as I'm concerned. We do like carbs, okay? They do add variety and certain taste and texture to our food, but they're not healthy. First of all, a lot of grains contain something called phytic acid, BHYTIC. These bind to various minerals like magnesium, calcium, iron, potassium. If they bind to these minerals, that means the minerals are not going to be readily absorbed by your GI tract. So that's not a good thing. Another thing is grains are basically pretty low in nutrients. I mean, they're not natural. I mean, I don't see any bread trees out there, do you? Or pasta trees or pasta plants. They don't exist. It's not natural. So they're relatively low in nutrients. And also, the most common of all your grains or carbohydrates, of course, is gluten. Is gluten, and which is wheat. I'm sorry, wheat, which is gluten. And why is gluten? First of all, gluten is actually a protein found in wheat products, and I'm not going to go into detail now about the why that's not healthy for you. But I think most people know about gluten. So grains really aren't great, and starchy carbs. I don't care if it's bread, pasta, even oatmeal. They eventually rice. They're going to break down to sugar. That's the end product, sugar, which is inflammatory. Sugar is the most inflammatory thing that we can ingest. And I've used this analogy for years, and I'll continue to use it. It's like pouring gasoline over fire, okay? And we don't want that happening in our arteries, do we? So if you really are interested in aging well, you don't need a diet high in carbs. That's one thing we need to really watch as we age. So what diet can we follow? And I think most of us will agree that the Mediterranean diet has withstood the test of time. It's probably been studied more than any other diet, and it's relatively safe because it's healthy and it's relatively unprocessed. So we I like unprocessed foods. And the major study that came about was the Predimed study, Predimed. And that made headlines in 2013, I believe. It's actually it's a large study that took place in Spain. And they did three different groups. One was the Mediterranean diet with olive oil. Second was Mediterranean diet with nuts. And the third was your healthy, so to speak, low carb diet. I'm sorry, low fat diet, which is the diet that we were having in the 90s, right? And which we learned really quickly that, you know, the the low fat, high carb diet actually was our nemesis because it led to a epidemic of diabetes and obesity. So, what do they find with this Predimed study? They found that the risk of combined heart attack, stroke, and death, okay, were reduced 30%. 30% in the Mediterranean diet with olive oil and 28% in the Mediterranean diet with nuts. And as opposed to the control group, which was your basically your low fat, high carb diet. And also, they found that patients with hypertension, elevated cholesterol, triglycerides, and obesity responded best to the Mediterranean diet. So I think we're pretty safe with the Mediterranean diet. If you ask me what I do, I kind of like to be a cross between Mediterranean and paleo. But paleo, it's like how I define it is that if it doesn't run in the wild or grow naturally on trees and bushes, it probably doesn't belong on our plate. But those are the diets that I think are pretty much easy to adhere to. And again, we're talking about unprocessed foods. That's the bottom line. Now, what about ultra processed foods? Okay, these are foods that are taken so far away from their natural state, it's just pathetic. Okay, so you have a long list of additives, artificial flavors, and colors, and numbers, and sweeteners, and preservatives. Um, these are really This is bad news. And what you need to know is that 67% of adults in this country eat ultra processed foods. But you want to hear what's worse? 70% of school age children. But don't take my word for it. What do you see out there? You don't see a healthy bunch of people. And that's why. So there's a great study that I came across recently in the Journal of Nutrition, 2021. And it was a 27-year study, which is pretty long. And they looked at junk food or ultra processed food and compared to red meat. Since red meat is supposed to be so bad for you, so says the American Heart Association and really traditional cardiology. So but what they found, the high consumption of ultra processed foods was actually linked with several cardiometabolic and cardiovascular complications, coronary artery disease. So with a large study, they had 13,548 adults from the ages of 45 to 65. So we consider this middle age. And it was called the Atherosclerosis Risk and Community Studies over 27 years. And out of that 13,548 patient population, 2006 developed coronary disease. And what you need to know is that 90%, there was a 90% higher risk of coronary disease when compared to the highest quartile to the lowest. So there's a linear relationship with how much junk food you ate and processed food versus your risk of developing cardio disease. So basically, junk food, ultra processed foods negatively impact inflammation. They are inflammatory, no question about it. They're, besides using carbs, which we already discussed, are high carbs, which is in itself an anathema. They also combine seed oils, soil oils that are pro-oxidant, things that you just don't want to be eating. So this junk food, this inflammation promotes inflammation and also interferes with a healthy microbiome. Now, anybody that knows me knows that I'm also very interested in gut function and gut health, which is, I know, unusual for cardiologists, but the gut is now being shown to be our second brain. So if your gut isn't healthy, you're not healthy. I don't care what you're doing. And I mean, we are all comprised of 10 trillion cells, but there's 100 trillion bacteria living within us. That's huge. So Um, you know, we have this very important relationship. As long as we take care of them, they'll take care of us. But there's a lot of people. I would say 60% people that come to my office for a cardiac related complaint also have a gut problem. And I'm teasing that out now, and we're working these people up, and we find that leaky gut and dysbiosis and irritable bowel and small intestinal bowel overgrowth. These are all related to poor gut function, and microbiome definitely can be challenged negatively with junk food diet. Um, so that's the important thing about diet. Now let's talk about supplements. Do we even have to supplement? I mean, there are still people, they're still purists in I want to call them from last century medicine, who think that you don't have to supplement. You get everything you want from food. Really? Today's food? I don't think so. Does anybody really think that? Now, when I got really into nutrition, I would say like mid 90s, I was really getting into it. They said, okay, we should have five fruits and vegetables a day. That was the recommendation to retain a certain amount of health. Guess what, folks? Now it's like 12 to 15 fruits and vegetables a day. I don't know, but who could eat 12 to 15 fruits and vegetables a day? I mean, it's just literally impossible. So we need to supplement because it's important to supplement our health. Why have if you read about, if you're interested really in supplementation, why is it bad talk? Why is it bad mouth? Well, first of all, we have insufficient research. There's no money in supplements. Okay, you don't see a big supplement company spending thousands upon thousands upon thousands of dollars to prove a point. They don't have the money. Big pharma, they got the money, and they can do what they want to. A lot of the studies dealing with nutrition, with supplementation, the funding is low, as I mentioned, and the studies are flawed by design. I mean, they almost make it look like you have to fail. So what I often see with these studies, and I read about a lot of them, is that either, well, there's no benefit from taking vitamin D3 or calcium or blank, 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 or worse yet, there's actually detriment. So it makes it look like this is really bad for you, or just not really of any aid. So patients walk around saying, well, I guess there's no reason to take supplements, so I'll just wait till I get sick. And they'll give me drugs. That's the prevailing feeling. So I don't feel that way. And we have to also consider the ill effects of commercial harvesting, the soil is depleted, shipping, food storage, processing, pesticides. There's so many factors that come to play, which explains why we do need to supplement in today's age if you really want to remain healthy. But it's not, supplementation is exactly that. It's supplementing diet. So it's not an exchange of, but you do need a little more than just what fruits and vegetables, you get more than what's available in our diet. Now, there's about 4 or 5 that I really recommend for those over the age of 40. I've discussed this before. First of all, omega-3 fatty acids. Those are essential fatty acids, meaning your body can't produce them. So you have to imbibe them. You have to actually ingest them yourself. And they're really known to be anti-inflammatory. But they have other positive effects. If you want to find something positive about omega-3 fatty acids, you'll find it, because there's so much utility about it. So there's 2 major omega-3s, EPA and DHA. And don't tell me to tell you what they stand for, because the name is like this long, and I can't ever remember, nor can I pronounce it. But they both have anti-inflammatory effects. But DHA is very good for the brain, the heart, and vision. Those are 3 areas we're really concerned about as we age. Coenzyme Q10 is another really important one. That's actually, every cell in your body needs CoQ10 to generate energy. It's part of the electron transport chain. And we make it, but as we get older, we make less and less. If you're taking certain medications like statins, you'll get depleted of it. So it's an important nutrient. And I give it also to patients that have heart failure, because a heart that is in failure is also a starving heart. These hearts really need supplements. And it's very keen on offering these to my cardiac patients. Vitamin D is the third one. Vitamin D is more than just a vitamin. It's really like a hormone. It has incredible anti-inflammatory effects. It's been shown that people that do poorly with COVID tend to have low levels of vitamin D. It also helps to prevent heart disease. It's a great thing that we all should be taking, and we all should be testing for it. And I do test for it. And the magnesium, which is the fourth most abundant mineral in our body, is probably equally important to take because about 60% of us are deficient in it to begin with. Most of it is in our bone and the rest in soft tissue. So doing a blood test for magnesium isn't very useful, but you can do a nutritional testing, which is we'll talk about that later in the Q&As if you're so interested. So those are the ones that I find most important for everyone to benefit, whether you're a cardiac patient or not. So what can you do? With magnesium can help convert food to energy. It helps to create and repair your DNA. It helps with muscle performance. There's so much utility in magnesium. It also helps with sleep, depression, and of course, heart health. So I'm a big fan. The last thing, of course, is probiotics, which I won't go into detail now. Probiotics is very important to help maintain healthy gut function. Okay, so we did diet, we've done supplements, now we do exercise. And my chapter's name, You Gotta Move, because exercise is so important. Excuse me. It helps staves off heart disease, dementia, diabetes, osteoporosis, cancer spread, cognitive decline. All these things are improved with exercise, with movement. But here's the facts, guys. Only 20% of the adult population exercises to the standards that we're trying to promote for everyone, which is, you're talking, so if you look at the U.S. government and the American Heart Association and the American College of Sports Medicine, they all are pretty, they think very similar about minimum effects of exercise, minimal periods of exercise. And really, we recommend about 2.5 hours of exercise a week. That's 2.5 hours. Okay. There's 24 hours in a day. There's 168 weeks in a year. So this should be doable, but the average person won't adhere to it. 20% is a low number, and I have a little sympathy for those that said they don't have the time. Are you kidding me? You're preaching to the choir here. And I don't care if you hate to exercise, folks, for one reason, so important, do it for your brain, because your brain functions well with increased blood flow. So I've known people that don't like to exercise, and they'll do it just because they want to preserve brain function. That's how important it is. So and then my one thing about is, of course, bodybuilding and resistance training. And of course, that's my big thing. But not because, I took it to a different level. The important thing is that muscle is your organ of longevity. I've discussed it here before. So if you want to live a long life, a productive life, you have to have strength. You have to have muscle. Why? Because you want to be able to open a window. You want to be able to shut a garage door if it's not automatic. You want to be able to open a jar. Well, you can't do that if you lack strength. So the most, like American Heart Association, American College of Sports Medicine, they recommend like 2 short periods of weight training a week. I would suggest 3 or 4, but I'd be happy if most patients could do 20 minutes of 2 sessions a week with strength training. I think it would really help. Okay, the fourth is stress management. And this is not really emphasized that well, because what is stress anyway? My stress may be your motivating factors. So it's hard to define, but I can tell you what I've been through. And if you read my book, I have 2 chapters that are cardinal to this whole topic. One is what I went through prior to my little heart attack. And you will see how stress affected me and how it impacted me. And the other chapter is on the health aspects of stress, what it does. And I profiled cardiac patients and cancer patients So it is important to look at stress. Now, one of my favorite videos that I made a few years back is that I produced myself. It's called Live Your Passion, Staying in the Present Moment. Because we spend so much time obsessing about the past, for which we can do nothing, and worrying about the future, which just brings more stress. We don't appreciate what we have right now because, folks, all we're guaranteed is this moment with me, because we don't know what's going to happen when we turn this video, the camera off. We don't know. So let's appreciate the moment. And that's one thing I've really, as I've gotten older, I've learned to appreciate more at the present moment. Um, so I think it's really important. So in my video, you see me doing the things that I love, which is like bodybuilding, and then I'm dancing with my favorite dance partner and teacher and dear friend, Lisa Nanziella. And then the third one is I'm singing. I have a vocal coach, and I've been singing for years. And when I'm doing these activities, I'm in the moment. I can't be thinking about what I could or should be doing. So I enjoy it. And then when I get out of the session, I'm in cloud nine. And so it's really helpful to pick an activity that you love. It could be gardening, it could be playing chess or playing bridge. Doesn't matter what the activity is. Find something that you like and do it. And that's really one way to manage stress. The other, of course, is exercise. Is a great way to deter stress. The other one is actually stress. Setting aside some time for breathing. Okay, breathe. And I've talked about this in videos in the past. Um, I do a meditation practice every morning before I even get out of bed. And I've discussed this before. You can do what's called a box breathing, which is in for 4, hold for 4, and out for 4. I prefer the 4-2-6, as I mentioned before. It's in my book. You inhale through the nose for a count of 4. You hold for 2, saying to yourself, 1001, 1002. You exhale on the count of 6. I'd like to put my teeth together and do a hissing sound. So it's like this. The reason I like to go for 6 for the exhalations, when we get excited and nervous, we're always going to inhale and we die, right? You have to take an oxygen. What we do, we forget to breathe out. We forget to really expand our lungs and then to get the air out. So by doing the 4-2-6, that helps. And I do that every day. And it's not always easy. Sometimes I soar through it. Other times it's like I'll start thinking about things I should be doing. And I'll say, wait a minute, stop, cancel, delete. That's not necessary now. I'll get back to my breath. So it takes some practice. I talked also a few weeks ago about the vagus nerve. The vagus nerve is the longest cranial nerve in the body. And when you think about that, you think about rest and digest. And there are ways to stimulate the vagus nerve, which we talked about. Then you can go to back to those videos. And so that's stress management. And the last is sleep hygiene. I meant to start with this. Okay, these are blue block glasses. So sleep is so important. When I was a student and an intern resident, we knew about sleep. I would brag, I get by with 4 hours of sleep. Who was I kidding? Who were we kidding? It was unhealthy for us to be working as interns and residents, working our butts off, and we're getting inadequate, broken sleep. It's horrible. And so it wasn't a gift. It wasn't something to be honorable about. It was actually a bad thing. And so now we know that 7 hours of sleep seems to be pretty ideal, even as much as 8. Um, 6 on a bad day, but anything less than that is not good. And you can monitor your sleep. Like this, there's certain wearables. What I have here is called the Oura Ring, OURA, and it tells me about my sleep latency. How long does it take me to go to sleep? With me, that's pretty easy. Another thing it tells me about is my REM sleep, rapid eye movement, which is kind of your period of creativity. And the other one that I've worked very hard, I'm working very hard to try to master is the deep wave sleep, the rejuvenation sleep. Okay. And that's really important. And so we now know that sleep deprivation is bad for the heart. There are more heart attacks and more strokes. Longevity is also less. And also, it impacts your immune system in a negative way. So it's just The sleep deprivation is a bad thing, and we need to really make sleep a priority. So these blue block glasses help to block out the blue light, the artificial blue light. There's one blue light that's really helpful, and that's natural blue light. So get up in the morning, and I don't care if you just sit outside for 5 minutes. You just take in the blue skies and just absorb it, embrace it. But we don't want artificial blue light at night. And of course, most of us are working at night on the computer, watching TV, etc. So by wearing these, it blocks out some of the blue artificial light. It's a good thing to do. So what I'm trying to do is to wear these about an hour before I go to bed at night. Um, so that's how I do it. When I go to bed, okay, I also wear this thing because I'm not completely. You don't have to be pitch dark to the point you can't even, see anything at all. But you want to be pretty dark because that helps promote melatonin production, which is in your pineal gland. So, I wear this thing, and very soft. This one's very soft and comfy. There's all kinds of face masks, eye masks, but it's helpful. A couple other things that I like to do is I try to go to bed and arise at the same time. This helps to set your circadian rhythm. These are things we never talked about in the past. So these are simple things. So cut off your screen time for at least 90 minutes if you can. So no computer, no TV. Read. It takes a little getting used to read with blue block glasses, but it can be done. So let's make sleep the priority it deserves. And that's about it, folks. So, you know, it's a lot to go over, but I just want you to walk away from saying there is so much we can do with regard to lifestyle and both treating heart disease and preventing heart disease. And this is something that is often ignored and not really embraced by the medical profession, whether you're a cardiologist or whatnot. So I just want to talk about everything that's positive and possible. Okay, now let's see if I have any questions here. So my glasses on. Can you please explain pattern A or pattern B as far as lipids are concerned? Absolutely. So you've heard me say before that bigger is better. Okay. So pattern A is what we want. We want big particle size. It's measured in angstroms. And so if you're looking at angstroms, you want to be greater than 222 angstroms, which is just a measuring way of doing this. And anything less than that is intermediate. Then if it's less than 217 angstroms, then you're small particle size. So why do we care? Because small particle size or small dents is more likely to get oxidized. Once it's oxidized, there's a chemical conversion that takes place. It's no longer LDL, it's oxidized LDL. And that's what we should be talking about, as opposed to LDL being vilified the way it has been for so many years. It's the oxidized LDL. So, yes, I want to try to convert my small dents to a large particle size. And partly that could be genetic, but there are things we can do to help with that conversion. So, pattern A is good, pattern B is bad. That's what you need to remember. If we eat too much fruit, are we going to get too much fructose in our diet? Good question. Again, that depends on what the fruit is. I gravitate toward berries. Um, blueberries are my favorite, but also raspberries. I'm not a fan of strawberries, blackberries. They're all good. They're low on the glycemic scale, and I don't think you can go wrong with doing any berries. Apples are good. Citrus fruits are pretty good. Bananas are pretty high in sugar, as are the melons. But there are healthy aspects to that as well. But it's in moderation. I wouldn't have three fruits for a dessert. Usually, I do after my dinner. I have a dessert, an apple or blueberries to finish off my meal. So I do eat fruits. I think it's healthy, but the fructose that I get worried about is the artificial crap, the high fructose corn syrup, and that's just pure garbage, but it's ubiquitous. It's in everything that's packaged, from certain from even some of these health bars have high fructose corn syrup. That's the one I worry about. Salad dressings. Um, Ketchup, these condiments. So if you look at the ingredients, you're going to see high fructose corn syrup. Sodas are the worst, the absolute worst are sodas. So I would worry more about the artificial high fructose corn syrup as causing damage to your liver and to your overall cardiometabolic state, and worry less about fruits. That's my feeling about that. Do you like to eat a lot of red meat? I personally like a varied diet. I do like red meat. I tend to go for grass fed because I think it's healthier. But I would say 2 times a week is what I generally would go for. At that, I I'm real snob when it comes to seafood. I mean, I'm real elitist because if it's not wild, I'm not going to eat it. I'm just not going to go with. I don't care how sustainable um, seafood is, but it's living in vats and cages. That to me is not natural. And then they're fed carbohydrates, starches. It's just disgusting. So, but I like a variety in my diet, and I do eat meat. I don't know how carnivores do it. I could not eat meat, and they say we eat from nose to tail. I'm not eating anyone's nose and anyone's tail. Uh, that's for sure. But to just eat that day in and day out, I couldn't do it. Now, there is one case in which a carnivore diet could be useful for a very limited period of time, and that's going to be people with with their gut is just wrecked. It's havoc. So they think it because meat products and are not going to really damage your gut function. They can help to heal it actually. So maybe while you're healing it, you go carnivore for a few weeks. I would never do it long term because you would more than likely end up with nutrient deficiencies, which we can test for. But again, even being a vegan, you're going to have deficiencies in certain nutrients. So I try to stay away from any extreme diet and tend to I'm like kind of moderate. Hope that answers your question. Okay, let's see. We talked about my glass. This is such small print, guys. I had to look at my. Okay. Okay, we talked about the fructose thing. Can you please explain pattern A? We did that. Can you please? Okay. Grass-fed beef versus chicken. Um, they're both good. I prefer free-range chicken if I'm going to have chicken at all. Protein. If that's red meat, is probably the most complete. That and eggs. That and eggs are your most complete source of protein. You cannot go wrong. So, even though the Heart Association would still say this is not good, and no more than 8% of your caloric intake should be from saturated fat, I don't agree, and I think that's not 20. It's last century thinking, and I think there's enough studies to prove that is not the problem. Okay, do I eat out a lot? Oh, oh no, do I eat? I didn't see that, but I'll ask that question. We really do best if we do most of our meals at home. Why? Because you know what's in the food, and you don't know when you go to the restaurant. If you go to a good restaurant, I don't know. Is it really grass fed? Is it really wild seafood? I don't know. I would like to think in finer restaurants you would be, but you know what's in the food. There's so much gluten, MSG. So much additives and stuff, and you just don't know. So if you're for optimal health, I would say certainly try to eat the majority of your foods at home. Okay, let's see. We'll make sure I don't miss anything. That's it. Okay, well, who knows? Okay, no, doctor. But red meat is not bad. No, okay. Thank you. Do they block arteries? I think that has been pretty much teased out. Yeah, like I said, from Ansel Keys back in the 50s and 60s. And I want you to know this was never, ever conclusively proven. But he was the one that started this whole bandwagon about, you know, red meat or saturated fat increases, it increases LDL cholesterol, which mysteriously gets inside the walls of the artery and causes plaque. Well, how does it just get there? It doesn't just get there. You have to have a diseased endothelium, which is another topic that I will talk about in a future YouTube session. You have to have a diseased endothelium, and you have to have like little holes in there which is disease, so that oxidized LDL can get in there and cause plaque. It's not just as simple as all that. So that was what they were thinking in the 60s and 70s, and some people still think it today. It's wrong. Okay, LDL is not your culprit. It's oxidized LDL. So I don't think eating red meat is is that bad. But I also don't. I'm still moderate. Like I don't. I like occasional plant based, occasional this, occasional that. I like variety in my diet. I think variety in your diet also amounts to variety in your microbiome, and we think that's very useful. So I'm not straight carnivore, straight this, straight that. I blend things together so that I have a varied diet that I know is healthy for me and for my microbiome. Okay. Okay. What test can I run for insulin resistance? Okay, good. You missed my topic 2 weeks ago, but I'll tell you what you need. You need to get either, well, Cleveland Heart Lab will do it, which is actually from Quest, or Boston Heart Lab. A couple other labs will do it, but you want to get at least three things. You want to get your fasting insulin level. So you have to fast for this. You want to get either there's a calculated value. It's called insulin resistance factor. If you do Cleveland, it's called HOMA-IR, which is homeostatic model of insulin resistance. If you're doing Boston, and they give you an idea how insulin resistant you are. And the other one is C-peptide. And that will tell me how hard your pancreas is working to not make you a diabetic. So you could have a high C-peptide and a high fasting insulin, and and your hemoglobin A1C, which tells me how well your sugars have been controlled for the previous 3 months, that could be normal. So your body is very smart. So it's going to do whatever it can to not make you a frank diabetic, but eventually a hell breaks through and you can't hold back anymore. So, insulin resistance is very easy to test for. I don't know why doctors don't do it. Insulin is not that expensive of a test. Maybe C-peptide is a little more costly, but you can certainly do hemoglobin A1C, okay, which is a marker in the red blood cells, and also and fasting insulin. That's for sure. Those two are just vitally important. So, I mean, you have to just demand it at this point. If your doctor doesn't do it, it's time to change because, like I said before, metabolic health is so neglected in this country. I mean, look what you see out there: obesity, 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 and diabetes. I mean, if I don't see another person with gunky artery syndrome for the rest of my career, it's fine with me because I've just spent 37 years taking care of patients with very, very sick arteries. And like I said last week, heart disease is a disease of excess blood pressure, excess cholesterol, excess smoking, excess stress, excess, it goes on, excess blood sugar, excess adiposity on our body. So, and lack of one thing, exercise. Okay, I think, let me make sure I got everything here. I guess we got it all. Okay, I just want to make sure. Okay, all right, guys, thank you. I'm so thankful. Okay, look, my little plug. I do this every time, but a lot of what I mentioned today is in my book. Wait, from both sides of the table, when doctor becomes patient. But if you read this little orange stripe here, it's really about becoming your own medical advocate. That's really what I'm talking about here. And so please get the book. I have my own website. It's called beyourownmedicaladvocate.com. Beyourownmedicaladvocate.com. That'll take you to my Amazon page where you can buy it. We also have a new website for supplements. And I don't remember the link, but we can give that to you. My staff has that as well. So now you can get your supplements online. All you have to do is just click onto the website, and all the supplements that we offer are listed there, but you can use the search button. So I'm hopeful this is going to take away from the back orders that we had, because a small office can't really handle a big supplement business, and ours is growing. So we're really proud. This is not an easy thing to put together. So you can get all your supplements online now. So I'm happy to announce that. Talked about the book. Thank you for joining me tonight. I'm very grateful. Please share this video with friends and family, because I think most people could appreciate it. And if you see any of my videos on YouTube, please click the like button, because ratings really do make a difference. And if you get my book, which I hope you will, please, please, please go back to my Amazon page and write a review. On the lower left-hand corner, it'll say, write a review. It really makes a difference. Okay, guys, thank you. It's been a great doing these 2 sessions on Heart Month, and I will see you in March and for new exciting topics. And by the way, if you have any topics that you would like to be discussed, that you'd like to have discussed, please drop me a line, and I'll try to comply. Thank you so much. Have a great night. Appreciate it. Thanks you for joining me.